Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, January 12th. Let me just check my paper there. And we are live to take your COVID questions. As always, you can put them into the box below on Facebook. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We've been getting a lot of vaccine questions in, and I do want to remind everybody that we are increasing every day the frequently asked questions, the videos, the specific questions that you are asking, and adding them to our website. If you go to the website, chicago.gov/coronavirus, right up at the top, you will see a tab here that says vaccine. And let's actually pull that up and take a quick look at it. We got that up? So when you go to the vaccine website, you can also get there directly, chi.gov/COVID-. Up at the top here, you'll see latest updates, which is where you can see what's happening with phases, things about vaccine planning in Chicago and data, get the facts, our frequently asked questions with lots and lots of the same kinds of questions we see coming in here. Encourage you to explore. Downloads is where you can see the top line messages for the week in English and Spanish, as well as lots of flyers and posters, social media. Please feel free to take these, use these, adapt these, put them on your own platforms, send them to your friends. We've got individual videos for some of the most frequently asked questions, in English and Spanish. We've got short PSAs, public service announcements, 15 to 30 seconds. We have toolkits here for healthcare providers in particular, other FAQs. We have materials here from events, press conferences, and then this is where we've been putting some of the behind the science videos. So if you have additional questions that you see not being answered here or that you'd like us to address, a lot of this is, we're working hard to make sure everything's in English and Spanish, and then a lot of the top line things we've been making available in 5 languages. And then where we're getting specific requests, we're actually developing even more specific information. For example, some of you may have been with us when we did a few long-term care facility focused events last week. We did a town hall, we did a press conference, and during that town hall, one of our local long-term care facilities said, you know, we have a lot of Korean-speaking residents and we need materials in Korean. So we made the materials in Korean. We are trying to do everything we can to have information that is accessible and appropriate and up to date for Chicago residents. So please do explore the website. As always, chicago.gov/COVID- will get you directly to the dashboard. Otherwise, under latest data is where, again, at the bottom is vaccine data, but it'll take you directly to the dashboard. And let's take a look at how we're doing with our numbers. Let that reload. So as you can see, today we're at 10.3% positivity. And if you look at the graph here, you can see we are just coming now down again after the little bit of the post-holiday increase. Some of that post-holiday increase is driven by the changes in testing. Nothing hugely concerning. We generally consider to see good improvement here. Our testing average is coming back up nicely, 11,277 per day. But if you look at the bottom here, you can see that at an individual level, we've been having 14, 15, 16,000 tests a day again. Where you look at the most recent days and it looks lower, that's because, again, it can take a couple of days for data to come in. And our cumulative cases are averaging just over 1,000 per day. We, of course, want these numbers to be even better. We want our percent positivity ideally down to 5% or lower, and we want our daily case rate down to 400 cases or lower. But seeing definitely some good progress, and I'm feeling confident. You can see here's what our case rate looks like, that just hopefully over the next week or so, as we really come out from this post-holiday period, that we will be back on a good downward trajectory. So I want to really, I think, get directly into your questions so that we have time. We're getting a lot of questions related to vaccine, and we'll take some of those. We're also continuing to get questions about some of the logistics. So happy to take any of those or any additional questions that you have. And let's just go ahead and get started with that. All right. At BinnyZ2 on Twitter. I got multiple side effects within 24 hours after the first shot of Pfizer COVID-19 vaccine, including fever, 99.8, headache, chill, achy joint, muscle, and arm. Should I still go ahead and get the second shot in 3 weeks? Great question, and the answer is yes. So we know that these short-term side effects within 24 hours, they typically will last, 1, sometimes 2 days after vaccine. That is your immune system getting the lesson on how to help protect you against COVID-19. So it sounds like, you had more of the side effects than some people do. I got my first dose of the COVID vaccine, really just had a sore arm, but this is expected, and it is not a reason not to get that second dose. It does tell you that you have a good, robust immune system that is really revving up and helping to protect you against COVID. So definitely recommend you doing that. Nat Ali from Facebook, how is Chicago planning for the new virus variant? Another good question. So as a reminder, the COVID-19 virus, like all viruses, does mutate. It is a natural thing for viruses to do that. We actually expect about one base pair every 2 weeks to change in the virus, and most of those don't have any actual impact in the way the virus interacts with humans. But there's been a lot of attention on this newer virus variant because the modeling suggests that it is more infectious. And so the way that we're planning is not really different than the way that we are addressing COVID anyway. The good news is that all of the new variants that have been identified at this point, the vaccine should still work against them, no problem. That's the most important thing. We've not seen any sign of any mutations or variants that the vaccine would not be effective against, and the scientists continue to check, not just for the vaccines that are in use, but for the dozens that are still under, in the trials, and that we're hoping will be able to join the approved the vaccines that are under emergency use authorization. In every case, the scientists are testing the variants against the virus, and there's not been any concern at this point. Also importantly, we've not had a variant that makes people sicker. So if this variant is actually more infectious, meaning more easily able to spread, what that means in practice is that we just have to keep doing the same things that we've been doing. So the masking, the social distancing, all of that continues to work. It's not that it doesn't work. It's just that there's less margin for error if people are perhaps putting aside some of those protective mitigation measures. We also are planning, and actually were planning even before this new virus variant, we've been working behind the scenes to really increase Chicago's capacity to do some of this molecular testing and what we call molecular epidemiology. Not just for COVID, but for any kind of drug resistance. It's good for public health to have more ability to bank. So if somebody is diagnosed with a disease, we can save a sample of that person's test in case we want to go back and look at it later. We do this for mosquitoes, for example. Every mosquito that we trap here in Chicago, we test it for West Nile virus, we look for any issues, and we store those. We have tens of thousands, probably hundreds of thousands of mosquitoes that are stored in our freezers here. And it gives us the ability over time to actually go back in case there were mosquito-borne viruses that were to emerge later. We could go back and see when were these emerging here. This idea of biobanking is a really best practice in public health, but we've not been well funded to do it. We used some of the COVID money from the federal government in the first round to build up Chicago's own molecular capacity to do some of this biobanking and to encourage our academic partners in particular to do this kind of testing. Many academic hospitals and researchers in Chicago already do this kind of testing, not on everybody, but on samples. And every virus that is sequenced, meaning that you look and see is it a variant, is uploaded to the international database of these sequences. So at this point it's not been identified, but We put out a request for proposal for about $3 million. Again, that was federal money, and invited any of the academic partners here to apply to be the regional coordinator for this kind of work. Rush University won that competitive process, and so they are in the process of being able to build up more of the bioinformatics work, regional coordination, and really increasing our local ability to do more of this kind of behind-the-scenes surveillance. So those are some of the ways that we're planning. But bottom line is that nothing changes. We are hearing that just the way that we've seen this spreading in the UK and others, the CDC has indicated they do anticipate that we will see this particular variant become more widespread. Probably what it would mean in an ultimate way is that we would need to vaccinate a higher percentage of the population to reach that herd immunity state. That's theoretical at this point. It's based again on modeling, but that would be probably the most likely thing that would change anything that we were doing here. All right, Donna Faber from Facebook, can you get multiple variants of the virus, like get sick more than once? Yeah, really good question. So this gets at the point of that we have seen people get reinfected with COVID. It does not seem to happen frequently, but we know that it's a reinfection because that sequencing is done. And so you can actually say, 6 months ago, a person was diagnosed with COVID. You look at that RNA fingerprint. You look at the sequence. You see what variant, if you will, was that person infected with. They recover, they clear it, they have, some protective antibodies, but we have seen multiple examples around the world of people then being infected with a second COVID infection. Again, not common, but it's happened. And we know that it's a separate infection because there are differences in the genetic fingerprint of those two viruses. So this is part of why we feel strongly about encouraging vaccine. Vaccine gives what's thought to be a more predictable protection against COVID. It focuses on the whole spike part, and it's an area that we continue to monitor. So again, the vaccine builds on some of the natural protection in a more predictable way than what we've seen to date. Okay, Joanne Doria on Facebook. Who will get the vaccines first for distribution? Doctors' offices or pharmacies? All right, so let's talk, let's kind of use that question as a jumping off point to talk about what's happening right now in Chicago related to vaccine distribution. So every week we receive a certain number of doses of Pfizer and a certain number of doses of Moderna from the federal government. That's based on population. So this week, for example, we got between 32 and 33,000 doses of first doses of those vaccines. Approximately half, 16,000 plus, are Pfizer, 16,000 plus are Moderna. For the last this is our 4th week that we're getting Moderna vaccine. The first 3 weeks, the great majority of that Moderna vaccine had to be pushed to our long-term care facilities. It's a requirement at the federal level to use the pharmacy program to make sure we have set aside enough vaccine to give to vaccinate all residents, all staff in our skilled nursing facilities, our assisted living facilities, the other behavioral health and other facilities that are in that long-term care facility program. More than 250 of them here in Chicago. Most of those vaccines have not been administered yet. They're meant to be used over the next few months, but there are many, many clinics scheduled, and again, that's what we were highlighting last week. We're using the Moderna vaccine for those long-term care facilities in Chicago, partly because we want to make sure if we need to come back more than 3 times, for example, or we're doing everything we can to get these highest risk settings vaccinated, we want to use the vaccine that has the most flexibility there for these kinds of settings, and that is the Moderna, because you don't need the ultra cold. So about 75% of the Moderna vaccine we've received to date had to be allocated toward those long-term care facilities, not really available for the public. This is the first week in a serious way. We've got 16,200 doses of Moderna vaccine that can go to outpatient facilities. So we highlighted this over the last week or two. We've been slowly turning on outpatient practices. And by turning on, I mean making sure that they're registered, they know how to report, they've gotten vaccine, they've had the training, they start vaccinating their own staff. And then importantly, right now they're available to help vaccinate non-affiliated healthcare providers. So we have a lot of dental offices and home healthcare agencies and morticians and dialysis centers and physical therapists and you name it, that all need vaccine, but are not in practices that will themselves become vaccinators. So we are enrolling both doctors' offices and pharmacies together. And we're actually now up to more than 250 vaccinating partners enrolled, new really, as of this week. And that includes about 100 or so FQHCs, about 100 or so other medical offices. And again, we're adding to these every day, as well as a lot of pharmacies. And more of these are coming online every day. We started, obviously Walgreens, CVS, and FarmScript have been our partners for this long-term care facility project, but we are also bringing online our Walmart pharmacies, our Mariano's pharmacies, our Jewel Osco pharmacies, independent pharmacies, and really getting them, really this week, the goal is start getting them vaccine. They vaccinate their own staff, they help vaccinate the outpatient healthcare workers, and then they're ready as we move into this next phase. So we think about these outpatient sort of together. It's not doctors first, then pharmacies. It's if you're going to be a provider right now, one of the major things we're doing is getting them enrolled. Diane Chabs on Facebook is adding on here, both administrations are recommending 65 plus. Is Chicago going to follow the guidelines? How does this fit in? So boy, let me tell you, I think there's been so much happening at the federal level, right? And I think this transition between administrations is a time of a lot of shifting in terms of priorities and guidance, and even a lot of the logistics in terms of vaccine. You might have been following the Biden administration incoming had signaled that they were likely to send all of the available vaccine as opposed to holding back second doses, feeling confident that they would be able to increase the production of vaccine so that we can still make second doses available on time as the FDA and CDC recommend. It sounds like now, kind of in the outgoing days of the Trump administration, they are perhaps also going to move to this. So we want to make sure that we are getting the amount of vaccine that the more vaccine we can get, the faster we can move ahead, right? This is really the ultimate plan. City of Chicago has set as an absolute goal every single week we want to push out, distribute at least 95% of the vaccine that we receive here in Chicago, meaning we push it to hospitals, we push it to pharmacies, we push it to long-term cares, we push it to doctors' offices, we use it in our own mass vaccination sites, which again kicked off over the last week or two, but are ramping up. So we're doing more additional sites this week. Those are going to continue to grow. But our goal always is to make sure that we're not sitting on vaccine in terms of not pushing it to providers, and then working with the providers to make sure that they're not sitting on vaccine and are able to push it into arms. We've received, if you set aside the long-term care, just over the first 4 weeks, just under 100,000 doses, first doses of vaccine, and that is, on the one hand, a lot of vaccine. On the other hand, we do have about 400,000 healthcare workers. They're not all City of Chicago residents, and we did take a broad view of what we meant by healthcare workers. We did not just mean the doctors and the nurses, but we really felt strongly about including anybody working in these healthcare settings, in hospitals, in clinics, folks working in security or environmental services, cafeteria, et cetera. We want that whole milieu to have access to vaccine. We also are vaccinating a lot of non-Chicago residents. That's been week by week, it's been hovering right around 40%. It's been between 39 and 42% of the vaccine that we're administering so far is not going to Chicago residents. Not a problem, but it doesn't show up in our Chicago residents vaccinated data. So every week we see how much vaccine do we get? Do we have to allocate some of it for long-term care, which now this is the first week that we're done with that part. We then look to really push it out, and we want to make sure that our outpatient providers are getting vaccine. So we've gotten about a quarter as much vaccine as there are broadly people available, who are eligible for vaccine in 1A. We have not seen everybody by a long stretch raising their hand to say, I want to get vaccinated right away. In some of the hospitals, we've seen a lot of people saying, I want to wait, I want to see my coworkers get their second doses. So now that we're into second dose, we're hoping that a lot of people will feel more confident, having seen people get both of those doses, be doing very well, which is absolutely what we're seeing. The safety data continues to look really good. That we will see some more increase there. I want to make it clear, and I mentioned this last week, that this works like a airplane boarding. Just because you missed your group getting called doesn't mean you don't get to get on the plane. So if you're in 1A, if you're a healthcare worker, you continue to get prioritized for vaccine even as we move ahead. And so as we look ahead, I think what's likely to happen here, and again, I want to know exactly how much vaccine we are getting here in Chicago. There's a lot in the news, but we sort of believe it when we see the vaccine allocated to us, because it's been a lot of moving pieces here. That if there are, we will need our healthcare providers, as they are doing this week, partnering to keep vaccinating. We had more than 115,000 outpatient providers sign up through their practices. We still had at least 60,000 that needed vaccine last I looked. A lot of them are getting vaccine appointments arranged this week. But what we'll likely do is, if healthcare providers have vaccine that would otherwise go unused, they will likely be able to start vaccinating some of their highest risk patients, but we're not going to be open yet. Our mass points of dispensing are not ready to be open at this point for older Chicagoans, but soon. And if more vaccine really does come with the promise for more behind it, I am feeling good about the ability to move ahead sooner than we otherwise would. Tiffany Hagstrom on Facebook. Are there any more vaccines close to applying for EUA? Yeah, we've been following this closely too. There's at least 2 more that are getting relatively close. Now remember, this isn't based just on time. The way that the COVID trials work, and just yesterday I filmed a vaccine about how the trials work and how we feel confident, how we can feel confident about safety and efficacy around those trials. So look for that look for that video. But you have to wait for a certain number of people in the trial to actually get COVID. That's how it works, to know that the vaccine is protective. You then unblind the trial and see, of all the people who got COVID, were hopefully most of them in the placebo group, the control group, and hopefully the people who got the real vaccine were very protected against COVID. So the AstraZeneca vaccine that has been approved for use in some other countries has been a little further behind here in the US. The FDA does have some stronger requirements around the amount of time that we monitor folks and some of the enrollment data here in the US. The Johnson & Johnson vaccine is also making good progress. I think it is going to be at least another month or 2 would be my guess before we see one of these really come forward. We will definitely keep you posted. I've got a whole team that's watching this closely. But yes, over this spring, as more and more of these vaccines do hopefully get emergency use authorization and become available, that will allow us to even more quickly open up vaccine. Carol Miller from Facebook. How will I know when it's my turn to get the vaccine? And I see good. Kristen Wise here, also on Facebook. Will the Chicago Department of Public Health have a website to sign up for if you're 1B or 1C? So right now, excuse me, sorry, my nose is itchy. You do not need to sign up on a website right now for 1B or 1C. We are not yet open to the general public for 1B or 1C. We do, and I think at this point, I hope all of the outpatient providers, have done the appropriate paperwork. We've been matching behind the scenes, a ton of work there. We had more than 5,000 practices register, and they're all getting set. If you want to make sure that you are getting the most up-to-date information, again, you're welcome to use Try COVID Coach. That's been open all along. We've seen more people enrolling there. We'll be communicating to you there just around what phase that we are in. But remember, most people especially those who are older in this underlying condition, our goal is for you to primarily be able to get vaccine through your healthcare provider or potentially through a pharmacy. We have a lot of work to do on the employer side that we'll be using pods for, et cetera. And so we will absolutely announce, it will not be a question, when we're able to formally move kind of publicly into that next phase. In the meantime, to this point of, if there are vaccine that's not being used, we may allow hospitals, for example, to, if there would be vaccine that would otherwise go unused, and they don't, and they've gone through all of the outpatient healthcare providers that have been assigned to them, they may be able to use the vaccine for patients who are hospitalized and being discharged to a long-term care facility, for example, or to their very highest risk hospitalized patients, or some other approaches, and there's some details around what that will look like. We may share additional information if people want to make sure and sign up, but you are not behind if you feel like I haven't signed up. If you want to sign up through Try COVID Coach to make sure you're in the loop, you can, but we don't need to know who you are individually at this point. Most of this will be through your provider. Your provider has your electronic health record. They know who is, in that highest age group, who has the highest who has the most underlying conditions, who is at highest risk. And then for people who are not connected, there's other plans in place for neighborhood-based and pharmacy-based vaccine. Okay. Tara Hines on Facebook. What is the timeline to finish getting healthcare workers and 1A vaccinated? When will first responders like police be offered vaccination opportunities? Okay, another good question. So we are already working on first responders here in Chicago, and we have been. We have what we're calling a public safety pod, a public safety point of dispensing. Again, this is what we call a closed pod, meaning it's not open to the general public. It's open, by appointment to people for whom it's eligible. And we started with our emergency medical service, our ambulance, paramedics, the people who are out regularly transporting people who are ill. They, of course, are healthcare workers. As we move through the Chicago Fire Department EMS, this week we're doing the private EMS, who also transport people, very vulnerable people, to and from hospitals and long-term cares around the city. We will be moving then into the EMTs, some of the other fire. That will roll along into police. That will roll along into 911. Sort of this public safety pod kind of continuing. In the same way, correctional, right? Already working on the healthcare workers at Cook County Jail, for example, rolling that into some of the correctional officers, and then as we roll into 1B, rolling into some of the detainees there. We have to make sure there's second dose availability. There's some more logistics around that. But the idea is, in each of these streams of essential workers, we get started, we do some prioritization always of who is at highest risk in that group, and then make sure we can continue to feed vaccine. So on the one side, as we think about moving ahead, we'll be able to push vaccine, but not enough vaccine at this point. 32,000 doses of vaccine a week against 360,000 Chicagoans over the age of 65, plus hundreds of thousands of essential workers, right? Like, there's just not going to be enough vaccine for everybody. And so we're working to make sure that again, within this, there is sort of sub-prioritization. We'll be asking healthcare providers to prioritize their most at-risk patients, and we'll be prioritizing on the employer essential worker side who is at highest risk within each of those age groups. So I think we're not likely to finish vaccinating healthcare workers 1A for a number of weeks, but that doesn't mean that we won't open 1B. I want to make sure, my goal is to make sure that these healthcare workers have appointments, that they've all had that opportunity to be connected to vaccine, but they're not all going to get vaccine in the next week or two. We don't have enough. They get priority for vaccine, and what we have promised is that, by the end of February, I hope before that, but by the end of February, anybody in 1A would be vaccinated. However, we don't wait to completely finish a 1A before we're able to move to 1B. It's this balancing act between making sure we've made access. And there's a lot of people who did not choose right off the bat to get vaccinated in 1A. They continue to have the opportunity, and in fact, the top priority when they change their mind, hopefully if they change their mind, to get vaccinated. So I hope that helps understand. At Calvin McCarter from Twitter, are EpiPens available at vaccination sites just in case someone has a rare allergic response? Yes. Maybe not an EpiPen specifically, but I can tell you at the Chicago Department of Public Health mass vaccination sites, the pods, for example, we have epinephrine that is already drawn up like it would be an EpiPen. In the unusual circumstance that we were to use this, we have paramedics on site. There is actually a requirement that if you are giving this vaccine, not just the COVID vaccine, but any vaccine, that you are set up for the possibility of an allergic reaction, that you have all the appropriate materials, and it's part of our training as we are pushing out vaccine to ensure that our vaccinating providers have all of the materials on hand when they are vaccinating. Again, this is not new for us. We're trying to build on structures that already work well for vaccine distribution in Chicago. But it's part of why I've gotten some questions about, can't you just send, a nurse out sort of door to door with vaccine in her pocket? And we can't right now. These vaccines are fairly complicated from a cold storage, from a dilution standpoint, and you do need to make sure that you have these, the ability to monitor people for a minimum of 15 minutes right now. You need to make sure that you have the materials on hand in the unlikely event somebody had an allergic response. So we are definitely at a point from an efficiency standpoint. You do want to be pulling people together with all the appropriate social distancing, whether that's through healthcare providers or through our mass points of dispensing. Okay. Let's see. Marie Caddick Green on Facebook. Will the second doses of vaccine be put aside for the long-term care staff and residents since you're now releasing all of the doses? How do we ensure healthcare workers will receive the second dose and receive it on time? Okay. 100% yes. So do you remember how I said that 74%, I think is the exact number, of all of the Moderna vaccine that we've gotten to date has been set aside for our long-term care facilities? Those same second doses will also be set aside, like as they come. To help people sort of understand where we are, we're only talking about first doses because otherwise I think it gets very confusing very fast. But under the surface, we're getting second doses. This last week was the first time we started with second doses. We send the same amount of either Pfizer vaccine or Moderna vaccine to the same locations to do the second doses. And let me just be very clear that we are absolutely intending to continue to follow the CDC and FDA guidance around the timing of vaccine administration. If there were to be any recommended changes on that, they would have to be done based on data, and we would follow federal guidance on that. But yes, we are holding vaccine. Remember, we built up the capacity here at the City of Chicago to be able to hold more than 130,000 of the ultra cold, the Pfizer vaccine, centrally, and we can hold much more than that, probably, I don't have the exact number, but more than 1 million doses certainly of the Moderna vaccine should we need to centrally. And we will want to be pushing this probably to providers. I think it helps everybody when you have the vaccine from a planning standpoint. But yes, we are doing a lot of work behind the scenes to make sure that second doses will be available. And if the federal government does decide to push those out, we can handle that no problem. My logistics team is truly second to none in terms of a lot of this behind the scenes, very technical work. Let's see. Louise Relling on Facebook. Why are other states open for 1B already? All my relatives in Indiana have appointments for later this month, and that's just one example. Okay, this is a really good question. So I want folks to understand that the way this vaccine was allocated was purely by population. And if you live in Chicago, you're really lucky to live in a healthcare center for the entire Midwest, and in fact for the country. But that means that large cities that are healthcare centers have a lot more people in phase 1A. So not just Indiana, but you look at downstate Illinois, there would be community areas there, whole counties that might have no hospitals, might have a handful of outpatient providers, maybe a dentist, maybe one long-term care facility. If you allocate purely on population, which is how this has been done, that those groups that are not healthcare centers will more quickly be able to get through that 1A priority group. But here we have a lot of long-term care facilities. We have a lot of behavioral health residential treatment, developmentally disabled treatment. We have a lot. 35 hospitals is a lot of hospitals because it's not just Chicago. We serve sort of as the central healthcare center for the whole region. And so this is not about holding vaccine back from anybody. It's about how vaccine has been allocated. Boston's been having the same problem. They're a major healthcare center for their region. Way more people are healthcare workers in that city and in Chicago than in many, many other parts of the city, the country. And so it will just take a different amount of time for different parts of the country to be able to get through a substantial enough portion of that 1A. 32,000 doses a week is the amount we're receiving, and we felt really strongly, this was in conversation with a lot of partners across the city, that these outpatient healthcare workers and the other high-risk congregate settings should get vaccine. Like, we have to make sure they're set up. We're not waiting to be done with them, but we're just now getting enough vaccine to be able to seriously get them started. So we will be moving shortly here, and a little more detail about that to come. There is not vaccine going to waste. Nobody actually asked that question, but I think people have this sense that somehow vaccine is like being thrown out or being wasted. There's not vaccine going to waste. Vaccine can be, and I think this is where people are getting mixed up. You have 6 months, actually, right? Like, from when the vaccine comes, it can sit in the freezer, it can sit in the ultra cold for months and months and months. Where the possibility for true waste would come is if you open a vial, right? Like this ultra cold Pfizer, there's 5 doses in a vial. From when I open that vial, I only have a number of hours to use those 5 doses. So you want to make sure you have enough people at that level. But that has been happening. We've not been having issues with that. But there's no vaccine that is being thrown out for sure, and there wouldn't be. It's just about making sure we're matching the need to the providers. And again, more than 250 outpatient sites, and providing vaccinating partner sites online, more than 250 now long-term cares, public safety pod going, correctional going, progress, pods opening, things are really moving, but we just have more healthcare workers here per capita than many other settings were. Blessing and a curse. Good thing when it comes to us being able to handle COVID surges, hard when it comes to vaccinating all of our wonderful healthcare providers. And so, yeah, Tamding Wangyal from Facebook, is our city behind in vaccinating seniors? Our city is not behind in terms of vaccinating numbers of people. We've not been able to move to seniors because of all of the healthcare workers. We will be able to, but again, we're not going to have enough vaccine for all the seniors at the beginning too. If you're a healthy 65-year-old, you're not going to get vaccine the first week as we open. It's just not going to happen. More vaccine becomes available, we can ramp up our distribution, and getting these folks enrolled will be a piece of that. So I know especially the older folks are anxious, and I understand that, and we will be able to start moving on here soon. Okay, Rachel Lessem on Facebook. For doubling rate, what date is your starting point? Is that constant? Doesn't that mean the doubling rate will already be getting longer? Good question. So the doubling rate we use from the start of sort of a surge. You can do some recalculation on that, moving sort of a week down. We've been looking at it both ways. We've seen the doubling rate, if the idea of the doubling rate is your outbreak getting worse? Is it getting better? We will see some fluctuation within that based on, and we've seen that actually sort of post-Thanksgiving and post-Christmas. But we do look at both sort of a static doubling rate from the beginning of a surge and a moving doubling rate, both. Richard Bloomfield. It looks like 80% of the vaccine that the city of Chicago has received is just sitting around unused. I don't know where you're getting that statistic, but that is not accurate. Again, putting aside the long-term care facilities, we've received just under 100,000 doses of vaccine. If you look on the website, you'll see, as of today, I think we were at 55-ish thousand Chicago residents for first dose. I don't have it right here, but we could pull it up. It's in that range. Remember, though, that only includes Chicago residents. It doesn't include non-Chicago residents who are also being vaccinated in Chicago. There is a lot of doses in the long-term care facility program that have not been used, but that is by design. Those are set aside for continued use over the next few months. We're pushing 95% of it out. People have been going through it. This is our week of transition, really, inpatient to outpatient, and we're going to keep moving ahead. Okay, I think we are just about coming up on time. I'm just skimming through here. Nico Sora on Facebook, is CPS going to lower the number of children in a classroom? Yes, pods are generally at 15 students, approximately 15 students, to help with spacing, to help with contact tracing when that's necessary. There was a press conference, a lot of information related to bringing our youngest students, pre-K and special ed cluster students, back tomorrow, and would refer you to that if you have additional questions there, but pleased to see that. Okay. If we didn't get to you, do put in your question, and we're going to continue to address these as you come in, but thanks for all the good questions that were coming in. Related to some good news, so we are doing a press conference at 1 p.m. today. Some updates to the travel order and policy, as well as just some general updates of where are we here in Chicago, a chance to answer questions. Those of you who are tuning in here know that there's ways to kind of get your questions answered directly, but we also do some of the press conferences, highlight various vaccinating providers, really try to make people understand where we are now and where we're moving. And I think there's likely to be additional press opportunities and outreach opportunities through the week. I also want to highlight Chicago Urban League is hosting the Impact Alumni Association's event, COVID-19 Vaccine in the Black Community, an honest conversation about history and health. It's today from 6 to 7:30 p.m. You can go to bit.ly/Black COVID vaccine. That's bit.ly/Black COVID vaccine. We'll put it in the link. Free, open to the public, and it's featuring Chicago healthcare professionals, including CDPH's own medical director for communicable disease, Dr. Candace Robinson, who's been on Facebook with me today. And then DCASE, the Department for Cultural Affairs and Special Events, announced a new Artist Response Program grant, supports artists that are responding to the recent health, economic, and humanitarian crises. There are applications that are due February 5th at 5 p.m. So if you are or know an artist here in Chicago, check out chicagoculturalgrants.org. Thanks very much for tuning in. We'll be back Thursday at 11. More opportunity to take your questions. Every day, I hope there will be additional clarity in terms of some of these changes at the federal level, working hard to be aligned with the state and trying to make sure that we get you the information. Nobody has missed anything related to sign up for vaccine unless you're a healthcare worker, in which case, again, I refer your practice to the healthcare provider portion of the vaccine website, chicago.gov/coronavirus under vaccine. Thank you, and we'll see you on Thursday. In the meantime, please be safe.